What's up, guys? I'm Angel McCautry, and I am here with one of my favorite people, Dr. Steve Stone. He's been practicing medicine since 1988, an athlete, avid surfer, now amazing doctor, and he has miracle hands, y'all. How you doing, Dr. Steve?
I'm doing great. How are you, Angel?
I'm doing good. Good to see you, and I'm glad I haven't been in your office too much.
Yeah.
But, we want to get down to the nitty gritty of like what athletes are going through. I just need to know, I got to start off with this. Why are so many athletes getting injured, tearing their Achilles? I mean, you see athletes from the 80s, they just wore Chucks and you didn't see so many Achilles injuries. What is going on?
Well, you just said what it is. That one of the biggest factors, the shoes. For 300,000 years, human beings, Homo sapiens, ran around barefoot, and the shoes make us move and put weight in a very different way. And frankly, so do chairs like the ones we're sitting in. So,
and my thing is like, so with all this technology, you mean to tell me the shoes and all this air bubble that we have and all these big brands, the shoes are messing us up? What about the shoes are causing these athletes to have injuries?
Well, when we come out of crawling, we're standing up for our first time, taking our first few steps. It's natural to go. We don't have the balance. Like a 2-year-old's not ready for a two-wheeler. They need a tricycle or training wheels. When we're walking there, we're walking heel to heel. We don't have the balance to put one foot in front of the other and stay up just like on a two-wheeler. So, but if we learn to run and walk barefoot, we'd start walking faster, and then trying to chase the other kids, we'd be pushing through the front of the foot, and 4 tendons then lift the arch of the foot. And that's how all the bones and the joints of the foot, I'm totally simplifying this, but that's how they are supposed to work. And as you do that more and more at 3, 4, 5 years old, running after the other kids, now you're leaving the ground and it hurts to hit the heel. So you would never do that. And now you're bouncing off the front of the foot, and those 4 tendons get stronger and stronger and stronger. And the arch of the foot being held up by those, and all the ligaments in that position get stronger. And that's the natural shock absorber. Not the Achilles tendon rupture we see a lot, not the medial meniscus tear like I had, not the ACL. Medial meniscus, though, that's familiar too, right?
Yeah.
And also, we're not putting weight to the side anymore, which is, we had a chondromalacia patella on your right knee that we dealt with too. So basically, when we put a pad on the heel of the shoe, and I'm wearing them too, it allows us to hit that heel hard and keep putting weight to the outside. So we don't learn to keep going through the front of the foot, strengthening the arch, and using the body's natural shock absorber. We try to put the technology into a shoe for that shock absorber, and all we end up is all the modern foot problems, fallen arches, plantar fasciitis, Morton's neuroma, hammer toes, bunions, and everything else, Achilles tendon ruptures, meniscus tears, ACLs, hamstring tears, labral tears in the hip. And this, along with sitting, is what contributes to all degenerative spine problems and disc problems in the spine.
Guys, so did you guys, okay, in a nutshell.
And there's more.
There's so much more to this.
Yeah.
And what Dr. Steve is saying is that it literally is our shoes that, because we don't have the foot doesn't have the strength in the ligaments, because we're not walking barefoot to strengthen our feet. All this air bubble, all this padding, it's actually messing up our feet.
It allows us to put weight in a way we weren't designed to.
You hear that? It allows us to put weight in a way we weren't designed to.
And we get injured. we should have known that before the surgeries. Like me too. I had surgery when I was 19. I went through 13 and a half years of pain. My knee could swell up and be swollen for 6 weeks straight, every step hurting. And I paid dozens of physical therapists and trainers, and no one had any solutions. My surgeon sure didn't. No one talked about these biomechanical patterns or how to change them.
But what about like insoles? We get the insoles that imprint our actual feet. Does that help? Because I can't wear shoes without insoles or my feet start hurting. Do they at least help?
Well, they can help with the pain. There's a double-edged sword there. So they do help the pain. You experience that. But if it's not a flexible insole, you're not going to be able to strengthen in that position.
Oh.
So the old fashioned 100 years ago, we came up with a hard orthotic, and podiatrists ran with that version of biomechanics for a long time. And it's just not, it's not accurate. Now they changed a lot of this in the 1990s in Europe. I was lucky to study with some people who learned some of the stuff from Europe where they'd start using soft inserts and then strengthening enough while with the soft insert. So an athlete or someone could keep training and then strengthening them out of the need for that.
Oh my gosh.
We're designed to run in bare feet.
So we're designed to run in bare feet, guys. Like that is literally the way to strengthen all the ligaments, your biomechanics, having everything in alignment, not having all these knee injuries. I see a lot of women limping all the time. It's so hard to watch. So what is the solution today, since our shoes are not made to really help with that? What is the solution?
Well, one thing would be to redesign some shoes so they're more flexible.
Now, I wear these every day, guys. Check these out. These are the Zeros, and these are flat, so I can strengthen the ligaments in my feet.
Yeah, these are very flexible. So this is more ideal, and it still has some protection so you don't step on glass or something.
Yeah,
that's much better.
And when I walk, it actually feels like I'm walking on the ground.
Yeah,
to strengthen.
Mm-hmm.
And when I started walking in these, I had no pain issues, nothing.
Yeah. Now, did you get those before or after the strengthening now?
I got these after the strengthening.
Yeah.
Yeah.
So it makes it a lot easier.
It makes it a lot easier.
Yeah.
Let's talk about some strengthening.
Yeah, let's talk about the strengthening.
We got to talk about the strengthening because obviously people know about my injuries, and you helped me put years of my career. I know I haven't got picked up or anything like that. You guys haven't seen me play in a while, but I'm still pretty damn good. Can you please tell them why?
Well, first we treated your injuries. We had a medial meniscus tear in the left knee. We had ACL tears in both. Both of them hurt. We were dealing with chondromalacia patella in the right, which is chondra is the cartilage, malacia is bad, and patella is kneecap. So it's bad. The kneecap, because we put in shoes, we put the weight to the side. The weight goes to the outside, and it goes into the ischiotibial band, the IT band that crosses the joint. It goes into the hamstrings on the lateral side. It goes into the rectus femoris, which is one of the quads, and the vastus lateralis, which is one of the quads. And it doesn't come to the vastus medialis here. And some bodybuilders like to talk about the teardrop. It looks like a teardrop because it's a good one to build for because it looks good. But because it was stronger on the lateral side, on the outside, the kneecap was getting pulled this way. And the kneecap, the patella, has the thickest articular cartilage in the body. So it's rubbing against it, runs in a groove, and it's rubbing against the side of the groove and getting irritated. And that can break down the cartilage.
Yeah.
I will give a shout out to Hua Gu, who is Dr. Gu. He was an orthopedic surgeon in China. He did the study on how to treat chondromalacia patella with acupuncture. That's why he got such a good, we got to give him a shout.
We got to give him a shout out.
Because the pain went away.
Because the pain went away. And literally what Dr. Steve is saying is because this side of our knees are so strong, nobody's building the strength in here.
Yeah.
So you get an imbalance in your knee, which causes a lot of the injuries, which causes the what is this called again? I forgot the name.
Which one?
In here.
So I tore
the patella.
On this. Yeah. So you tore your medial meniscus.
That's what I'm saying. Meniscus.
I tore my right ones because if I'm pushing to the outside, like you're on your right knee, your kneecap went that way. My knee, I was a little bit bow-legged. We call that genu varis in medicine. And there I'm pounding and grinding because I was also running on my heel at the time. Yeah. Because that's improper. And I tore up my medial meniscus.
So a lot of people have meniscus problems, like you said, because the strength, where there's no strength in here, is pushing your knee out, and the knee is basically imbalanced.
Yeah.
And so we're going to take a quick break so I can show you guys what we do. I put 9-pound plates on each side. Explain to them real quick, Dr. Steve, before I show them the clip.
Okay, so what we did to get you playing again, we did a thing called static contraction. We did a static hold on a leg press. And the reason why is because we had to make the vastus medialis stronger than the outside because the body wants to use the stronger structure. It's very natural.
Yeah.
And so until we got this stronger than this, the body wanted to keep using the outside and keep putting weight to the heel. So the fastest way to strengthen something, and there's a lot of misconceptions about this in sports medicine and in physical therapy. The fastest way to strengthen is more weight. It's not time, it's not reps, and it's not range of motion.
Say that one more time, Dr. Steve.
The fastest way physiologically to strengthen tissue is not time, it's not reps, and it's not range of motion. It is weight.
It is weight.
Yeah. It's in fact, weight is so much more important that it can cancel out those other factors. Like you could do all kinds of reps with a band. Like you could do 1,000 reps at the physical therapist office in a certain pattern. And if you're stronger out here, you're going to walk out to your car and your body's automatically going to put weight on the outside, because most of us are. Most of us have a shoe with a pad on the heel, and we can. So we push the feet apart and push the weight to the outside. And now you've just canceled out everything you did. You could sit there for an hour and do 1,500 reps.
It's nothing.
And it doesn't matter.
It does not
your
work.
Body, the moment you put weight on it, says this is stronger, and it forgot it. One step in, one step.
One step. So we're about to demonstrate how much weight I can do. I usually do 10 plates on each side, but this one only has 9. But take a look right now. All right, so you guys saw the clip. Can you believe I can do that much weight? Dr. Steve, people think I'm crazy when I'm in the, I see men looking at me like, what the heck is this girl? Is she on the No, I don't take anything. Explain to them why I can do this much weight, Doctor. Nobody thinks they can do it.
Well, we started with, I think I told you, if I remember correctly, because after the second treatment with acupuncture and some myofascial release, you had no more knee pain. So I told you we practiced just doing a wall sit where to put your feet, and you texted me the next day, I just put 300 pounds on my leg. And up until that point, how much weight, what was the most weight you'd put in any physical therapy exercise? A TheraBand or a?
Probably just nothing, like.
So see, what the body listens to is weight. So as soon as you started walking on an ACL graft, now after a week, it's really pointless to do that more than a week.
Mm-hmm.
So we had to do 2 things. We had to strengthen those ligaments. The graft, they say you got to walk for 6 weeks while the body repairs it and actually rebuilds your own ligament while the graft is holding its place. Well, the cells that do that are called fibroblast cells.
Oh, so
That do the healing and that do the,
you can say that part again.
okay. We'll wait till the,
Yeah, we'll wait. Cut for a second.
Sorry, we'll be right out.
No, it's okay.
Yeah, here's all my
All right. In 3, 2, 1. You can say where you started from.
okay.
Because editing.
So the cells that do the healing
Mhm.
are called fibroblast cells. They build up strength after a workout. All of the soft
Too loud?
tissue, we call them fibroblasts.
Okay, go ahead. Sorry. Oh.
And they're what going to rebuild. They are the cells that are going to rebuild the ligament after the graft is in there, and they're going to rebuild your own ligament. So yours gets totally rebuilt. Now they generally tell anyone after a surgery, you walk around for 6 months, and in those 6 months, your fibroblast cells rebuild that ligament, and then you start rehab. And what do they do at the physical therapist? A TheraBand. You've already been walking your full body weight through it. So that not only does it make 0 sense physiologically, because your body ignores that if you're putting more weight in another way, but also, why did it tear? And does anyone talk about these biomechanical imbalances that cause the injury? And should we put the body in the proper balance and fix that imbalance so you don't get
Fix
hurt
the
again?
imbalance.
Yeah, and I've had athletes that have gotten multiple ACL tears before they get this correct.
Yeah.
But my question to anyone doing rehab or any surgeon would be, where is the physiological evidence that you should be walking 6 months to strengthen that ligament before rehab? I sure haven't found any, and I've certainly found a lot of contradictory evidence, and that's what this is based on. There's a lot of data out on this now. There's a guy named, first time I read about it was a guy named Peter Sisko. I'll give him a credit. You can look up his books. He did static contractions. He's been training bodybuilders, I think, since the late 70s, early 80s. And he started measuring who got stronger. And he said, wait a minute. He would go less and less range of motion and fewer reps. And as long as he used more weight, they still got stronger until he was holding it still and they still got stronger.
Wow.
And that's a principle.
That's the principle.
Yeah. Now, a lot of people have used this principle. In fact, the our weightlifters, the United States team, has used this for decades.
Mm-hmm.
And when
It works.
Sivko, one of his books came out, they admitted that's what we're doing. But it's how you get it's how you get strongest the fastest. And in fact, we had you doing 1 minute of leg workout a week.
Just 1 minute, guys.
And yeah, you after I told you what to, you texted me, I did 300 pounds. The next week I went to the gym with you. We did 600 pounds per leg. The week after that, we did. So when I told you what to do when he practiced at the office,
Right.
he texted me the next day and said,
1 minute of work
yeah,
per week.
yeah. And what we talked about is doing 3 10-second holds with the foot in the right position without moving at all. So the next day you texted me from the gym.
Mm-hmm.
I just did 300 pounds.
Mm-hmm.
And I texted back, I'm coming to the gym with you next week. That's not enough weight.
Right. And what did I do when you came to the gym with me next time?
600 pounds. The
600.
week after that, 700. Week
Yeah.
after that, 800. Week after that, 900, and then 1,000.
So I'm at 1,000 pounds, guys, as you saw today in the clip. Can you please tell the people how many years did I put on my career from doing these methods and practices?
Well, when you asked me, I said, it's however long you want to play. That the ligament can hold 1,000 pounds. You're not going to get hurt.
Yeah.
Yeah.
So guys, you hear it from Dr. Steve. I mean, can I get a chance? Can I retire on the court? It's cool if y'all don't want, I'm into other things with it, but I have years of my career
Yeah.
because of these methods.
Yeah.
Call me crazy. It works. And because of this, my strength, I can hang with any 20-year-old.
Yeah.
Tell them.
Mm-hmm. And you're not going to get injured. And I mean, what you told me is
Can
I
you get
can
him
still
say
talk,
that?
so
He's not going to.
I don't think too many people are going to.
Guys, I can still grab the rim. No problem. There's 20-year-olds that can't grab the rim. I can still grab the rim. I'm totally healed. And these methods, it's just, I don't even know what to say. Like, it's amazing.
Yeah.
A quick question for you. What injuries do you see most with the patients that come to you?
I have a national board certification in orthopedics, so a lot of what I focus on is knees and ankles and feet and legs and hamstring tears and labral tears in athletes. And I had a new labral tear this week, but it's in a 75-year-old, but still the principles are the same.
Yeah.
Shoulder injuries, sometimes the labrum in the shoulder, rotator cuff tears, repairs that post repair sometimes, biceps tendon, lot of spine, a lot of spine injuries and pre-surgery, post-surgery, and
let me ask you this, and obviously I've proven this, but an athlete can be stronger after a major injury. I think there's a myth that, I'm never going to be, once you get cut open, it's never the same. We hear that so much.
Well, that's a great point, because we hear stuff like that, and you can only make it less weak, or you can only slow down the degeneration. We used to say that about bone density. And now there's a company called OsteoStrong doing exactly what I do. I cured cases of osteoporosis 15 years ago.
Wow.
None of the physicians could believe it. It's the same principle of strengthening. Now they got computerized equipment doing what? Static holds and pushing against the patient.
God.
And they're curing they have people in their 80s, mid 80s, regrowing their bone density in weeks.
Guys, he's curing osteoporosis.
It's
And what's the
science
company?
is out there? OsteoStrong.
And OsteoStrong, they're helping
I'm not
cure us.
making it up.
Yeah, so with he's curing osteoporosis. There's the company called OsteoStrong that is doing this. It's the same principle.
Yeah, of strengthening is weight, and they're just doing 1 minute a week.
Yeah,
and again, Pete Sescall, he did the science on this. He did the numbers, and this is basically what our Olympic weightlifters doing. They would even be doing it less than once a week. They're doing 3 10-second holds, so 10 seconds on, 10 seconds off, 10 seconds on, 10 seconds off. 10 seconds on, wait a week, then max it out again, just 3 10-second holds without moving. Then, because you increase the weight, you need more time to strengthen. You wait 10 days, Then you wait 14 days, then 17 days, and then you roll out to 21 days between workouts. And everything that I grew up with, it was all about keep going, working out more and more and more. And that's not how strength happens. Now, there's a lot of different ways that you need to condition for different sports. So you have to get cardio, you have to get muscles to engage in the right order and get integrated movements. And those are all fine. But my point would be, why not get those ligaments and any other part of your body so strong the fastest way to a point where, like you are now, there's no chance of injuring it. And you're stronger than you've ever been. You're going to dunk harder than ever before.
Stronger than I've ever been.
Yeah.
And I like that. Y'all know I love to jump in the air.
Yeah.
How important is mobility versus strength? Is it more important to be mobile or to be strong?
Well, it's both.
Okay.
Flexibility is a big component, but strength does not mean a lack of flexibility. We have to keep stretching. There's things we can do to keep the connective tissue. Again, acupuncture is a great tool for that. But stretching, and particularly holding stretches a long period of time, 5 minutes or more, like some of the old yoga poses. But
man, to hold a stretch for 5 minutes, I can't hold a stretch for 30 seconds. 30 seconds holding a stretch is so hard. Like it could be nauseating to stretch, but the way you feel after,
yes,
like a new body.
Yeah. And and the science will probably progress on this. We know that repetitive motion can trigger cells from fibroblast and fibroclast cells. Clast cells tear down protein and tissue. But the brain will tell those what to do after 5 minutes of input. We know clinically that repetitive motion also does it. And we just don't have the data on that. How many reps, if you're training for a marathon, how many steps do you have? How many miles before the body restructures some of the connective tissue to be both strong and flexible to help you do that? That
is it.
That is something.
Yeah.
We don't have that. We have a definite 5 minute mark where it starts to change connective tissue and when you're stretching. And that comes from an acupuncture study.
Yeah.
So
I love that. Yeah. And I really got to bring this up because this is so important. A lot of people are hearing from doctors, just get surgery, just get the surgery. And I know, for example, my dad tore his Achilles way back when. He did not get surgery and he healed on his own. Went back playing like nothing ever happened. He's still playing tennis to this day, almost 70 years old. No problem. How could he heal from an Achilles and go back to playing basketball without surgery?
Well,
and yeah,
there's a study being done right now at UCLA that they're looking at ACL tears, and the study is about doing things to encourage these things to repair without surgery.
So there's a chance that you could tear your ACL and not need surgery.
Well, yeah. Now, I can't really tell a patient that because I don't want you to limp around. The safest, fastest thing is probably to graft it. But what if you can do PRP and some other things, maybe some acupuncture? And here's why this study is going on. We've seen on MRIs that some did reattach themselves.
Wow.
And
do you guys hear that?
Yeah.
Some ACL ligaments have reattached themselves.
Yeah.
But we would never know because everybody's always getting surgery so quick.
Yeah.
How would we know?
Well,
and I wish I could have tested that out. I would have loved to at least test that out to see if my ligaments would have just reattached on their own. Maybe.
Yeah, maybe, but that's why the study is being done. We don't know how long it would take. We don't know.
Okay.
Here's what we do know. In 2018, a great study came out on scar tissue. And scar tissue continues to proliferate and contract on itself indefinitely, as long as there's any inflammation whatsoever in the area even.
Yeah.
The inflammation tells the fibroblast cells we're in acute mode. It's the fibroblast cells sense the scar tissue and they start building more scar tissue. That's the first phase. Scar tissue has actin fibers in it, so it contracts. So it is possible that the scar tissue could reach out and link together. Maybe you do a PRP, which would create platelet-rich plasma that makes the blood coagulate and clot, and maybe then the fibroblast cells would build more scar tissue because of that as well. And acupuncture increases fibroblastic activity as well and gets the brain involved. So acupuncture is actually a very powerful tool you can use with PRP, and it rapidly accelerates healing, even way above just a plain PRP. It's because it gets the brain involved in some way. Yeah.
So PRP, guys, with acupuncture is like the ultra blast of everything.
Yeah.
But I do want to ask you about that. Stem cells or PRP?
Well, it's going to depend on how you because a lot of people are spinning blood to get more stem cells and using that. That can increase stem cell activities. It has now been proven as of, I think, 3 weeks ago, we got published. There are acupuncture points that increase stem cell activity in the body.
Just by acupuncture?
Yeah, this is new. Now, the data, when you look at the data from some of this stuff, there is so much strengthening. In order to get fibroblast cells, any blast cells in bone, they're called osteoblasts, cartilage, or chondroblasts. Acupuncture needles excite those and get them started. It also gets the brain involved to give them instructions. Without the brain involved giving them instructions, we don't really know whether they're going to do anything besides build scar tissue. So they see inflammation, they see scar tissue, they will build scar tissue. Needs to be more studies on this.
Gotcha.
But we've now proven acupuncture, but when you look, acupuncture stimulates stem cells. But when you look at the data, in order to get, for instance, your ligament strong and your knee strong at that rate, we have, like, you can do to excite fibroblast cells, one of the things you need is something called growth factor. This is actually a combination of many things. Platelet-rich plasma, that injection has platelets. It makes platelets make blood coagulate. So you shoot in blood that's got a lot more platelets than usual. It makes the blood coagulate very quickly. And because there's more platelets, they give off more growth factor. It attracts more fibroblast cells. And that's what accelerates healing.
Nice.
But we see in things like acupuncture or with the static colds, we see accelerations of healing that are shocking. As you noticed, getting up to 1,000 pounds in 4 weeks on those, and then being able to play and dunk without any problems or pain after 2 years, more than 2 years of not being able to, that was what, 4 minutes of your life? Yeah. We need growth factor. Okay. When you do exercises where you're doing range of motion, fibers are sliding past one another, muscle fibers. And there's little filaments between, they cause little micro tearing. It's very normal when we work out. As you move, the brain also picks up on feeling the pressure against little bits of scar tissue and sends messages to fibroblast cells to chew up the scar tissue, as the blast cells then lay down healthy protein that's more flexible. And the brain orchestrates that. So we do know that more repetition on it and moving it does help the brain. We don't know exactly how much movement, how much time, how many reps. But in order to stimulate those things, what you get with the PRP is you get the initial growth factor that causes scar tissue. You hope the scar tissue pulls, and that sends messages to the brain. And then the fibroblast cells get messages from the brain to now build the healthy tissue, and the brain also sends signals to the class cells to tear out the scar tissue. So you get the range of motion back and strength and flexible tissue that you can use for athletics or just for regular life. When you put acupuncture needles in, it puts pressure on the connective tissue, and the brain orchestrates the whole mechanism. Fibroblast cells, they'll just be dormant in tissue. They come out of the tissue. These fibrocytes, we call them sites in when they're just sitting in tissue. They'll come out of the tissue, and they can turn into, depending on what the brain tells them to do, class cells to take down scar tissue, to chew it up, or fibroblast cells to build tissue to the brains. And that happens with an acupuncture needle. But we pretty much know that when you do the static hold, we're not tearing tissue. So it's not going to be tearing and then scar tissue and scabbing and platelet derived growth factor. It's going to be growth factor because the brain tells the fibroblast cells to come out, secrete their own growth factor, and get to work. And they attract other fibroblast cells that get messages from the brain. Again, in both, whether it's the static hold or acupuncture, we see times where the healing seems to be much more than expected. How did so many cells get involved? How did we get so much growth factor? How did we get such an acceleration of healing? So I've been telling people for 10 years there's going to be a study that shows acupuncture stimulates stem cells because it's too much strengthening, it's too much healing. I think we'll have that same thing with the static holds or with more weight.
I love
because
it.
you saw what happened. Yeah.
Absolutely.
Yeah.
Absolutely.
That was
I'm a witness.
No one, and there's certainly no one at this. I remember when he did 900 pounds, the guy was waiting for the cheek.
Oh, yeah.
Talk, he was stuttering.
And my camera guy is now a witness. Ethan in the back, he saw it today. He was like, what?
Yeah.
So-
So you saw it. Good.
So before we get out of here, Dr. Steve, I got some rapid fire questions, some fun
Yes.
questions for you. Ice or heat?
We've gotten away from ice. We've gotten away from ice 12 years ago.
What?
Yeah, the studies came out, and I would like to give him a shout out. I can't remember the doctor's name. The guy who coined the term RICE, rest ice compression elevation, in 1978. I'm sorry, I'm not recalling his name. He was one of the first people to say, "Wait, we were wrong." Now, when you put cold on something, blood vessels and tissue constrict, so this pushes blood away. That can be good if you're trying to keep swelling down. And warmth will make things open, so new blood comes in.
So warmth will help swelling more than cold?
Well, the
It's a
new
catch-
acronym, yeah, you don't want too much, especially you can cause too much swelling and pain. The new acronym is movement compression elevation. So a cold plunge that what we find with ice is it can cause frostbite. It can damage proteins. It can damage tissue. If you're in cold and then hot back and forth, that can open and close blood vessels and push
So that's the
fluid
best way.
out. That can work.
All right, guys.
But moving it around, and specifically
Massage.
Well, yes, but also just moving the body, walking, running, moving, and doing the type of oscillation.
So it's called warm up.
Well,
Warm up, ice, heat, compressed. Right? Ice, heat, ice, heat. That's the best way, obviously.
I wouldn't even go to ice. Maybe cold and hot alternating.
Cold and hot, cold and
Yeah.
hot, cold
But
and hot.
I would move it.
Yeah.
Rhythmic movement
Yeah.
is
So would you say stretch before or stretch after? Hey, Olga.
Hi, girl.
It's my girl.
Long time no see.
No, I know, right? No, it's okay. Would you say stretch before or stretch after?
I would say walk briskly for 3 to 5 minutes, maybe light jogging, then stretch, and
Okay.
definitely stretch after.
So basically before and after.
Or
But
after.
once again, that warm up piece, guys, that warm up piece,
The blood flowing.
tape or brace?
Well, it's going to depend. If something is torn to the extent where we have to let it mend, we can't let it move too much so it won't mend. Just like but what you can do is you can immobilize it and you can still do a static hold. See,
I love
you
that.
have a partial pair, but with the static hold, you're not moving. Yeah.
Yeah.
So you can get more bone density. You can get fractures to heal by putting weight through. I got to give Claude Gu a shout out again. He did a PhD on an ancient, I think it's 1500-year-old bamboo and silk way to treat compound fractures in the lower leg, where you just tighten it, pushes the bones together instead of building a cage where the vectors of the weight go through the metal of the cage and the bone doesn't heal. So you can put weight through it while it's immobilized.
I love it.
And that's going to depend on the different fracture or something, but same with ligaments.
Yeah. Yeah.
Help athletes with ligaments with
Right.
static holds. And
Yeah.
there's someone playing on a professional sports team in LA starting right now that did that.
Exactly.
So
Who is that did that?
it's a HIPAA violation. I can't use
Okay.
names.
We'll keep that secret. Surgery or rehab first? I already know what he was going to say.
It's going to depend.
Okay.
It's going to depend on the injury. There's some things, but again, we're opening up the idea that, hey, you can get a lot of strengthening without movement,
Yeah.
and that could be safe
Yeah.
before surgery.
Yeah.
It's going to depend on the injury.
And best underrated recovery. So she's like, black person. No, I want to take photo. I'm first time in America. Best underrated recovery habit.
Best underrated recovery habit? Ooh, that's a good one. Leap is very good.
Oh, God.
Leap is very good.
Can we normalize naps?
Hey, I'm for it.
I want to take a nap.
Been napping my outfit.
I would actually love to just have a date and we just take a nap. Let's normalize naps, guys. It's the best thing ever. I love a good nap. You ever have to nap so long that you got to get ready for bed after?
Mm-hmm.
I heard that as a joke from a comedian, but yeah. But Dr. C, man, this was so great. I feel like we only given people a little peep of what this whole thing is about.
Yeah.
And we can go on for days about this, guys, because there's so much to it. But the main thing, like Dr. Steve said, is getting your biomechanics in your body together. Any last words you want to say before we head out?
Strength is your friend.
Strength is your
Weight
friend.
is your friend.
And a lot of weight, guys.
Yeah.
Not this many weight. You
Yeah.
saw the weight I did today.
The thresholds are usually, well, we do it one leg at a time. So more than double your body weight per leg is the threshold where you get big gains.
Yeah.
OsteoStrong, going to put it on the website. It's 4.2 times your body weight with both legs at a time to get bone density increase. So it's significant, but that took you 1 week? The first 6
1 week. It took me 1 week to get to 600. The next week I was at 900. I'm over 1,000.
Yeah.
I would love to get to 2,000 pounds, actually. So very soon. I don't even think the bar will be able to hold all the weight that I'll be able to do soon. And Dr. C, where can they find your practice or anything? Or
You can look me up at stevestoneclinic.com. Yes.
all right, you see it below, guys. SteveStoneClinic.com. Check them out. Everybody, don't bombard my doctor, okay? I know you guys will be seeing me like play. Maybe if I'm not in the W, you'll see me be still playing in leagues and stuff. But you'll see how good I am, and I owe it to Dr. Steve. He's amazing. Thank you, Dr. Steve, so much for coming.
for having me.
Absolutely.
3, 2, 1.